Many people think of Africa when they think of HIV/AIDS. I just spent a week traveling across the continent and saw again firsthand the devastating effects of the pandemic. But the scope of HIV/AIDS is not limited to Africa, and the consequences of the disease are equally grave for every infected person all across the world. To help ensure that people everywhere are able to access the care and treatment that can save their lives, my foundation is partnering with the governments of over 25 countries, including a country many of you care about deeply, the Dominican Republic. Over 88,000 people in the Dominican Republic are living with HIV/AIDS. 15,000 people need treatment immediately, but the vast majority, upwards of 80%, don't have access to the medicines that can save their lives. My foundation is working closely with the government of the Dominican Republic in a host of ways to help to change this. Through our purchasing consortium, we're lowering the cost of essential drugs and tests, and we're training local clinicians, nurses, and health educators to ensure that the treatment people get is high quality. In rural areas, where prevalence in some places is approaching 5%, the HIV/AIDS burden is often the greatest. People in these areas lack not just access to basic healthcare services, but also to food, transportation, and information. My foundation is working with partners to pioneer new ways of reaching these often neglected people. With the support of your host this evening, Sterling Stamos and the New York Mets, we've helped 5 new clinics become operational in the past 3 months in rural areas of the Dominican Republic. And we're lucky to have so many committed and passionate partners in the effort, including Esperanza and Dr. Paul Farmer's wonderful organization, Partners in Health. Together with our partners in the government, we're making sure that all Dominicans living with HIV/AIDS, from children to adults, in cities and rural communities alike, are able to receive the care and treatment they need to live a normal life. I hope that in my lifetime, by working together, we can turn the tide on HIV/AIDS and give everyone an equal chance at life. Thank you all for coming, for caring. Enjoy the game.
The Dominican Republic, one of America's nearest neighbors, projects the image of a land of natural beauty, sunshine and beaches. At the same time, a place for boundless sporting talent and a cradle for baseball that is second to none.
When I think about the Dominican Republic, I think of a country of 2 realities. I think a lot of wealth, great beaches. At the same time, I compare all of that with all the poverty that we have that surrounds us.
There is also the other image of the Dominican Republic, a country struggling with poverty and its associated social problems. With 1 in 3 here living below the poverty line, life can be a real and constant struggle just to provide the basic necessities of food, shelter and clothing. As a result, healthcare for the poor is an ever-worsening problem.
When I see my country and I see our land and our people, there is no reason why it have to be like this.
The Clinton Foundation understands this situation. With the assistance of Sterling Stamos, their ability to help the needy in the Dominican Republic will be greatly enhanced.
The Clinton Foundation has done a tremendous job of lowering the costs of HIV treatment. So that is a first overall impact.
The provision of affordable antiretroviral drugs, making people aware of testing, and the training of professionals are part of the Clinton Foundation's 5-year plan to reduce the incidence of AIDS.
Our overall mission, as it is for the Clinton Foundation in each country where they're active, is to help the government develop the capacity to treat their patients adequately. That's basically it.
The underprivileged in the Dominican Republic are living in towns and villages like this all over the country. This is La Lecheria, near Santo Domingo, where the need for help is obvious to any observer. Poverty and unemployment go hand in hand, and the local clinic acts as a rare beacon of hope.
Nosotros en este momento estamos trabajando en varias zonas del país, a la ciudad de Santo Domingo, una zona, como te decía, densamente poblada, con mucha gente que está sufriendo la epidemia del SIDA.
Local doctors are advised by Clinton Foundation staff on how to maximize the benefits of available drugs and other therapies. And Dr. Ledesma will also visit bedridden patients in their homes.
We try to go to the places that are in need of attention, and we try to improve the programs and the initiatives that Clinton Foundation have, as the Rural Project or the Pediatrics Initiative. ¿Tiene que comer? ¿Cómo te lo estás tomando? Explícame cómo te estás tomando. Eso por la mañana, eso en la noche. Vamos a tratar de hacer eso, vamos a tratar de llevártelo un poco para que traten de al mismo tiempo ir haciendo.
The work of the Clinton Foundation produces tangible results. Based on their successful model in Rwanda, plans are in place for them to again join with Dr. Paul Farmer's Partners in Health to help disadvantaged Dominicans living near the Haitian border.
The main effort that we make here is in the area of training, mentoring of medical personnel.
Pero sobre todo está llevando a esa gente esperanza, gente que creía que iba a morir, que estaba condenado a muerte. Este proyecto de la Fundación Clinton, eso es lo que está llevando, es la oportunidad de vivir a mucha gente, a muchos dominicanos pobres.
Helping people help themselves has become a mantra in the philanthropic world. Esperanza is the very definition of this concept. Esperanza, the Spanish word for hope, provides a lifeline to families who wish to help themselves. They receive low-interest loans that enable them to build a business in their community.
The original mission and the mission as it's been since the beginning is to free children and their families from the bondage of poverty and to create a better future with hope.
Mi negocio es vender arroz, habichuela, quiero ampliar la fantasía y yo vendo carne de pollo, de todo, yo vendo muy poquito, lo que no tengo es muchos recursos, oye, pero todo eso pasito y pienso que con la ayuda de ustedes y del banco, del progreso, pienso ayudarme mucho.
It is made clear that this is a loan, not a handout, and that the repayment of the loan is vital in enabling Esperanza to make other loans to willing participants. The families group together to form banks, known as Banks of Hope, to receive and repay the loans.
Esperanza, también suplan mis hijos, mi familia y sobre todo el país, porque superándome yo hacía ayudo al país a que se supere y eso se lo voy a deber a Banco Esperanza.
To date, over 95% of loans have been repaid, a sure sign of the success of the program. In a town near Santo Domingo, profits earned by one Esperanza loan have been used to build a badly needed school.
Yo me siento muy agradecida de haber conocido la institución Esperanza Internacional, porque por medio de ella he obtenido mucho logro y que han sido de bendición para mí y también para el prójimo, en especial a la niñez. Gracias, Esperanza.
Every one of us in Esperanza, everyone in our team, 53 of our staff, see this work as a vocation and serve with passion our people.
That passion is personified in Met's General Manager Omar Manaya, a Dominican American who also serves as an Esperanza board member.
No, por favor, no se me aplauden a mí, apláudanse ustedes.
He too recognizes the value of the Banks of Hope.
These banks are kind of giving hope to a lot of women, a lot of men, that do not have the ability to go out there and get a bank loan. But it gives them a sense of empowerment that they feel part of the community, help out the community, and are able to improve their self-esteem.
Hay mucha gente que están muy agradecidos porque dice que no sabía que fuera de ellos si esa institución no había llegado aquí a Ulloa. Entonces nosotros le damos las gracias, 1.000.000 de gracias. Señores, ustedes están ayudando mucho a los pobres de aquí, de la República Dominicana, y nosotros estamos muy satisfechos y que sigan así, que cada día crezca más.
My hope, my desire is that we can expand and continue expanding this so we can replicate this model and reach out thousands and thousands of families and just being a tool, a vehicle, so we can change their life for a better future.
Omar Minaya also visits his home country in his role as general manager of the New York Mets. Everywhere he goes, Omar is on the lookout for the next great baseball talent. But there's also time to offer some encouragement and remind himself of his roots in the game.
Baseball has always had a way of bringing people together in a lot of areas in our overall in the history of our society. The purpose for us in baseball in the New York Mets is a way of doing things to help give back to the community.
The Mets Academy affords a great opportunity for Dominican kids to better their lives through baseball. The Mets organisation also requires aspiring players to attain a level of education that will stand them in good stead for whatever the future brings.
All right, how are you guys doing? Good? Yeah. All right, I see that your English is getting better. The goal is not only to do well as a team and as an organization, but it's also by doing good, by giving back in the community. We want to win, we want to do good, but we want to do good by giving back.
With the full participation of these well-respected organisations, the Dominican Republic has good reason for hope. The future of any country lies in the health of its society, the chance of economic advancement, and the opportunity to lead a better life.
But you have really a triangle of baseball, the Esperanza Foundation and the Clinton Foundation. That's a very strong combination. And when you have all those components together, the community wins, and it's a start for poverty being eradicated.